Welcome back to What's Up. Urinary tract infection, or UTI, is an infection of any part of the urinary system. The urinary system is comprised of the bladder, kidneys, ureters and urethra. This week, we'll learn more about this disease on What's Up Doc.
Hi doctor, I just want to ask about UTI. Is that correct that most of the girls get infected by this disease? Thank you.
Urinary tract infection means there is some bacteria or abnormal organism that should not be there in the urinary tracts. And what we mean by urinary tract is the kidney, ureters, urinary bladder, and urethra. If there is bacteria in those areas, it means that the child or the adult is having urinary tract infection. The causes are not a single cause. It depends on the age of the patient, and usually there are different causes regarding the age-wise. For girls, the urethra of girls is near to the vagina and the anus. So sometimes there is some sort of contamination of the urethra from those bacteria normally present there. So the girls are more prone to urinary infection because of this. If we went up a little bit, for example, for pregnant ladies are much prone to urinary infection because the uterus will be big and it will obstruct the ureter sometimes and causing some back pressure and hence urinary infection. The symptoms are very peculiar and almost straightforward. The patient, whether he is a child or adult, will have frequency of micturition, means he will go to toilet to pass urine frequently, maybe every 1 or 2 hours. Sometimes he will have foul smelling of the urine itself, or he will have fever and pain in the flanks, in the sides of the back. These are the symptoms of urinary infection. Before we treat, we have to prove that this is really a urinary tract infection. How to prove it? We have to do what we call culture. We take sample from the urine and we put it in the lab and we see whether there is bacteria or not. So based on this culture, we select the antibiotic and we give the patient the treatment maybe from 7 to 10 days based on the causative organism. We advise all the patients with urinary infection to have plenty of fluids in general or water so that he will feel that he passes urine frequently more than usual for him. This will wash out the bacteria and take out the infection with the help of antibiotics.